Hi, I'm Dr. Ryan Stoll. I'm an expert in prevention science, and today we're here to talk about World Suicide Prevention Day. So World Suicide Prevention Day is really this focus initiated by the World Health Organization several years ago to call attention to a major leading cause of death in adults and young people, suicide. Suicide today is the second leading cause of death among young people and young adults. And this is despite the fact that there's several statewide and national level initiatives to prevent suicide attempts and suicidal ideation. So now we're in a space that the World Suicide Prevention Day really calls to attention the need for us to do more, to do something better, to serve our youth and to serve our communities in ways that we can actually reduce suicide to an acceptable level of zero. When I hear these stories from our school, partners, these, lead psychologists, the coordinators for their mental health initiatives telling me that, they just had an elementary school student die by suicide, it breaks my heart. So when we think about early warning signs, what we're seeing from the research literature and what we're seeing from our own experiences in this space is when youth are disconnected from social interactions, when they're feeling like they don't have a home, a place that they can call their own in terms of their social and lived experience. And, feelings like they're just a burden to their family, they're a burden to their friends, and they begin withdrawing into themselves to the point that they're not reaching out, they're not asking for help, they're not looking to get that support that they absolutely need and deserve. So when we think about how we can begin to think about suicide prevention, we need to think earlier on as opposed to the last chapter in somebody's book where so much of these efforts have gone on already. We need to take it much, much earlier where we can begin to build the supports around the child, the social connection, the relationships, empathy between people, feeling that they can handle stress even when it's through the roof, that they can manage what they are going through, and really helping them understand early on that they are not their thoughts. They can disconnect from what they are thinking versus who they are at their core.